Hi, everybody. Welcome to the Medicare Secondary Payer an Introduction Part 2 webinar. Last week on 7:30, Karen did the Part 1 webinar where she gave you the basic information. This webinar is designed to support that webinar, but also answer questions you had. So with that, I'm Tom Ryan, and I'll be your presenter today. I am joined by Karen, who was last week's presenter, so we want to make sure we can respond to any questions that you do have. We would like to remind you that this is an educational webinar, so you want to make sure you view the information at the end, which is the disclaimers. What's our goal today? Well, our goal is to review the material and answer the questions from the July 30th webinar. That's what we're going to get through. We'll do a brief overview for the previous webinar information. We will have an interactive review session, and then we'll have a question and answer session. Now, the question and answer session will open with pre-submitted questions. We had 57 questions for this event out of 161 submitted. What did we do with the rest of the questions you might want to know? And those are all related to future Medicare secondary payer events. So we specifically advertised this one as a basics or a getting started. We will not be going into billing and into all of those different areas. It gets to be too much and people actually do get confused. So please limit your questions submitted in the chat to the basic type questions. If you do submit a question not relevant to today's material, we will add it to our list and give it to you in the future during one of the other webinars related to that type of question. Let's go ahead and get started with the overview. Again, this is a brief summary. If you want the full overview, please feel free to go to YouTube, look for the 7/30/2026 webinar, and that will get you what you need. So we were asked to provide a better understanding of the MSP process and understanding the overall MSP. So we began with, well, what is MSP? Well, okay. MSP is when another payer must consider the charges before Medicare. Couple of things to call out here. One, consider the charges does not mean they have to pay. They could apply it to deductible. They could say this isn't part of our program, but they have to consider the charges. Also, please note it doesn't say insurance, it says payer. Why is that? Well, if someone is at a business and they say, hey, I don't have that type of insurance, then they are considered self-insurance. That business can be responsible for it. So we'll get more into that as we get a little bit more. But that's why Medicare secondary payer isn't truly about insurance alone. It's just when there's someone responsible for paying before us. Now, what may Medicare do? If you've submitted it to the primary and the payer says whatever they're going to do with it, Medicare may still apply it to deductible. They may make an additional payment. They may waive the patient liability or other pieces of information without an additional payment. So there's a variety of things that happen with Medicare secondary payer, and that's why we want to talk about it. Medicare secondary payer is commonly referred to as MSP. MSP. A little bit more, we were asked about the coverage types for MSP. So CMS does break this into two different categories, and then each category has two subcategories. Give you a high level overview and we'll get more into it in just a little bit. But first, there is group health plans covering all Medicare covered items. Group health plans are related to employment. Okay, so there's employer aged, large group health plan, and end stage renal disease. And we'll talk a little bit more about some of the different definitions that go with that in just a few slides. Non-group health plans. These are related to an accident, illness, or injury and are a diagnosis-driven primary insurance. That means they are not primary for all. They're only primary for those diagnoses. So that's what it is. It's a primary payer. Okay. Moving along, why did this get put into place? My favorite comment, and thank you for this one, you did make me laugh, was that it's to annoy the provider community. Well, no, that may be a side effect, but that is really not the goal. The goal was to save the Medicare trust fund money, to look at who should be responsible for paying first and having them pay first. Also, it can increase provider revenue. Now, this is one that some people will go back and forth with, but let me give you an example. You have a Part B outpatient service bill. The primary allows it a certain amount, and Medicare allows it a certain amount. Medicare will say, hey, our allowed amount's lower than the primary, but because there was a patient liability, we're going to pay you the difference. You get to keep the difference, even though it's above the Medicare allowed amount. So if you only had Medicare, you wouldn't get as much money. That's how we can increase the provider revenue. And that is one example. There are other examples. We just wanted to give that one because that seems to be the most common situation. You can also avoid recovery and payment issues. So that is very big. So for any of you that have gone through the Medicare secondary payer process, or when there's a primary payer to Medicare, you know that if it's not reported correctly as the updates happen, we take money back from you if you've gotten a payment. So you can avoid that process, make sure the money gets returned correctly, do a lot of different things. So from a claims perspective, if a primary payer is reported, it can stop all claims from processing. So that's why you want to make sure reporting is kept done and accurate. Also, it can cause, again, those overpayments. Somebody asked a great question. Are the overpayments always reviewed by a person? Now, that's kind of a summary of their entire question. And the answer is no, not at all. Sometimes overpayments are simply done by the system. So lots more going on with that. There was a question about responsibilities. So we put who's responsible for what. First, the patient must maintain accurate records. Please don't laugh at that. That is the true line from CMS and what should happen. Now we say should happen because patients don't always do that. So there are ways in which we can get those updated without the patient. Providers should follow the billing guidelines. And part of the billing guidelines is checking for accurate records to make sure the information is updated. As a Medicare claims processor, the Medicare Administrative Contractor, or MAC, which WPS is, we must process all of the claims according to the Coordination of Benefits System, which is a COB system. That system is actually updated by a different contractor called the Benefit Coordination and Recovery Center, and their job is to determine who is primary. That's not our job. So they'll put information into the coordination of benefit systems, which then does eventually transfer to the claims processing systems. So our job is to make sure we process things correctly and to calculate the coordination payments. So how much did you get paid primary? How much do you owe? Did you get the difference, and what do we owe you from Medicare? So there is a formula for that. So yep. So when are you required to determine whether there's a payer in front of Medicare? This does depend on whether you are a hospital or a facility versus a professional. Now, the way that a hospital and a facility is defined is, do you bill on a UB04 or 837I institutional electronic transaction? Do you bill on a 1500 or 837P professional transaction? Professionals are one set of rules, hospitals and facilities are another. So for hospitals, you do have to determine always at the start of care. Well, that makes sense. Again, professionals and suppliers, you do have to do that as well. Then at a hospital or a facility, every inpatient admission, you must determine this. There is an additional criteria to say if there's a reoccurring service. So this would be outpatient physical therapy, occupational therapy, outpatient cancer treatment centers from a hospital. You must determine at the start of care. We've already talked about that. But then as a hospital or outpatient facility, you have to determine every 90 days. For professionals, the best line that CMS has for that is, and I'm going to summarize it, this is not the actual verbiage from CMS, but you must determine as often as necessary to maintain accurate records. What does that mean? Well, that does mean the start of care. If you don't know if they have primary, you got to start there. We will recommend using the reoccurring services or every 90 days. Now, the reason we do recommend that is it does give a clear picture and tells us if the changes have happened. Okay. So that's some more about that. I do want to let you know that on the bottom of the slides, there's a reference for you. Go ahead and check that reference out if you need it. Where? Well, there is something that is an exception, which is why this where is there. So if you notice, the first bullet says it applies to all Medicare providers. Then there's the exception bullet, and that says reference and hospital lab exceptions. The reason this is an exception is they don't need to ask the questions. They don't need to determine it. They don't see the patient. So how are they determining that? On the other hand, they are still subject to overpayments. So they may want to ask whoever is giving them the specimen, who's ever giving them whatever they're analyzing, hey, does this person have primary payer? Right? They still have to somehow determine that. Otherwise, their money will be taken back as well. So when you look at it, it's any setting, yes, exception, reference and hospital labs, because they don't actually see the patient or talk to the patient. That was a great question that came with this. Where is, do I need to ask questions or gather this for telehealth? Yes, yes, you do. Why is that important? You're still able to gather the information verbally, so you can ask a series of questions to gather that. Can be part of your intake person, whoever doing that initial screening or initial call, getting them ready and set up, but you still have to ask. How? Well, CMS has designed a series of questions, and this is sometimes called the MSP questionnaire or MSP questions. And the reason this is important is it's a logical progression of steps to ask for each category and subcategory, category and subcategory for Medicare secondary payer. Again, we'll talk a little bit more about that in just a few moments. Okay. So, should you keep these questions? Yes, that's how you're going to do it. Here's the catch. Does it have to be these CMS questions? No. What it has to be is a series of questions or a series of information to gather all of the information. So we want to make sure we have that. We want to make sure it's available to you. Somebody did ask me a great question, and they're saying, we read previous education and it says you have to hold it for 10 years. Why is that? That's actually in the IOM references. You can see it there on the bottom. So you do have to maintain these records for 10 years. The one thing you don't have to do is have the patient sign it. That's why I told you you could gather it verbally. Great. Could you gather it electronically and have the patient do an electronic questionnaire? Sure. Could you display something for the patient saying, this is what we have on file as your primary? Is this still correct? And they check yes, and you're done. You can do that too. So it really is about getting all the information and then verifying that everything is still correct. One of the big questions that I got, and I got quite a few of them, so I put this slide in to kind of summarize them all together, is timely filing. Medicare is a 1-year timely filing. So what happens when the primary payer doesn't process it within that time limit? So the first thing I want to make you aware of is that timely filing is not waived for primary payer situations. So just because they didn't process it doesn't mean you shouldn't file it. We understand that it is going to cause a denial. We know that. That is normal. How do you determine how long you have to file it? This will depend on whether it is an inpatient or an outpatient claim, regardless of what you bill on. Inpatient claims, it's the through date on the claim. Dated discharge is another way of saying that. Outpatient or professional services or supplier services, such as ambulance and lab, it is 1 year from the date of service. If you file it in that time frame, even if you don't have a final denial or payment or decision, we can work with it once it is finalized. So that's timely filing. Make sure everything gets filed timely. Medicare primary payers situations, not it. Okay. Another great question came in is there certain things that Medicare will automatically be a primary payer to? And the answer is, yep, there are. There's types of coverage. First is Medigap, which is a plan established by CMS that you actually put information on your claim so we can electronically send it to. It's Medigap. There is supplemental Medicare plans, and these are plans that specifically state they are supplemental to Medicare in the policy. So those are, and then there's Medicaid plans because, well, they're the payer of last resort. So Medicaid. So those are just a few examples of when situations will be, when payers will be supplemental. One other question that we got, which led me to put this slide in, is for the VA or Veterans Administration, what happens as a secondary claim? First, I want to let you know that the VA is not a secondary payer. The actual law states that if one federal entity or federal program makes a payment, another one is not allowed to pay. When the VA authorizes outside services, they pay at 100%. Therefore, Medicare cannot pay. For inpatient claims, if the VA makes a payment and Medicare pays based on a per diem, a prospective payment system, that is considered a payment we're not able to follow. For outpatient services, we do have to look at whether or not the VA authorized that service on an individual line by line basis. Also, this is a great one. Are Medicare Advantage plans primary payers or secondary payers? And the answer is they're neither one. Why? They are replacement for traditional Medicare, which is Medicare Part A and B. So it is Medicare. It is not primary or secondary. It is Medicare. So hopefully that answers those questions for other payers. One of the things that I'm going to do, sorry, before I leave this other payer slide that I forgot, is I was asked if I could very quickly summarize the process. So I want to do that as a review before we move on to the data. So first step in the process, providers or their representatives are encouraged to gather the MSP information. Now, again, you can go online and use an online tool. You can ask the patient. There's a variety of methods to do that. If you find MSP information is not correct, then you need to update that information before billing Medicare. Then the next step in the process is to bill Medicare accordingly. Now, I will tell you later this year or next year, and I'm not sure exactly what the dates will be, we are doing two separate courses. One is for billing on a UB04 or 837I. The other course is for billing on a CMS 1500 or 837P. So you'll want to watch out for those. I have a sneaking suspicion they'll be early next year, but again, Karen and I haven't finalized that plan. We have to look at the data, determine where you guys' questions are coming in, what other courses we have to do before we can get to billing. So what makes sense before we get to billing? So a little bit more to come on that. All right. So that is what you need to know. I also want to remind you that the last step in the process still states that you must bill the patient if there is a liability. How do you know that? Well, the easiest way to determine that is to start with the Medicare allowed amount. Have you been paid between the primary and Medicare up to the Medicare allowed amount? If you say, yes, I've got that amount, it's fulfilled, then that's great. Don't bill the patient. If you say no, now this happens a lot of times like in January, February, things like that, and you say, oh, I still haven't met all these deductibles, then yes, you bill the patient. Hopefully that makes sense. There was a question posed with the billing the patient amount, that allowed amount process, to summarize this. I'm going to answer the question real quick. If you receive more money from the primary insurance than the Medicare allowed amount, can you bill the patient? No. That's what our formula may actually waive, is the patient liability. We will still apply the deductible. We will still show a patient liability. We do have to calculate all of that. However, you can't bill those to the patient. Okay, you got more than the Medicare allowed amount already. Do you have to return the extra money? Don't do that. That money is yours to keep. The protection within the law is about the patient protection. It doesn't say you have to return the extra money. That is part of the Medicare secondary payer rules within the law. So it doesn't state that you have to return that. On the other hand, it says you get to keep it. Hopefully all of that makes sense. If not, put some questions in the chat. We'll get to those at the end. Let's talk a little bit about some data that I found relevant and interesting. And it is about why we do these particular courses. So the first thing I want to point out is we're going to look at some claims data, then we'll look at some call data. The claims data is high level and basic, but it was 4 claims submitted, and it's all claims submitted between 4/1 and 6/30, all jurisdictions, okay? Which means J5 and J8, Part A and Part B, depending on how you bill, it's everything there. It was updated as of July 9th. So, yep, this is the data that we're going to look at from the claim. What's important to understand? Well, first, I'm going to start with FIS rejections. This means, hey, we didn't pay your claim. We sent it back and said something's not going to work here. So again, FIS processes the UB04 or the 837I. Okay? And it says, hey, in J5, how much money did these edits save us? And the answer is $11 million, a little over $11 million. It represented 84,000 plus lines. So you can see it is definitely doing its job. That's what these edits are designed for. In J8, it's about 13.5 million, representing 62,000 lines. So the data does vary just a little bit there. On the other hand, MCS, which is the multi-carrier system, which is what is built on a 1500 claim form or 837P. And again, you can see in J5, which is Iowa, Kansas, Missouri, Nebraska. I'm not sure if I said that already. And J8, Indiana, Michigan. But J5, it is $8 million for 73,115 claims. J8, $132 million for a little over 1 million claim line units. So when we talk about this, this is what we're doing. We're trying to avoid all of this. Now, these types of denials and issues do lead people to call customer service. Well, that makes sense. You're trying to figure it out. So we tracked for J5, it'll give you the Part A calls, again, UB04, 837Is, and the Part B calls, 1500, 837Ps. It's also going to then give you the Part B calls on J8, and I want to highlight that. But remind you that that was also the highest level of line denials, so it's got the most calls coming in. That makes sense. For J8, the Part A calls is much lower. It's actually the lowest number. So for J5, it's Part B calls that are higher, and so is it in J8. But notice the significant difference there. Again, please understand we have more providers in J8 as well, so there's a couple of different things going on. All right, that brings us to the end of the summary. Before we get into the interactive questions and response, I do want to ask Karen if I have any questions in the chat that should be addressed right now.
Tom, we haven't had any questions come through the chat yet.
Okay, so as we said, this summary is coming from, or this interactive session is coming from a summary. What I'm going to do, and you'll see it happen right now, is if you look in the chat, there should be a question launched. Karen, can you see my question? Did it come up?
Yes, Tom, it just came up.
Okay, so I'm going to move my slide deck, but you guys got the question. Please feel free to answer it. So the first question, what does CMS use Medicare secondary payer to reference? And then you get to pick one. So when there is a payer paying after Medicare, when there is an insurance considering the claim before Medicare, when another insurance must pay a claim before Medicare, or when another payer must consider a claim before Medicare. Oh, good. Oh, yeah, I'm great. Great. You guys got this one down, man. 90 some percent are saying the bottom, which is D. So that's awesome. Sorry, we just dropped to 86, but still, that's great. We really do want to make sure everyone is aware of that. Okay. I'm going to reset the results. I'm ready to go on to the next question. So the slide answer is D. Oh, sorry. Go back. There we go. Sorry, getting used to using this. So the answer is D. They have to consider it. Now remember I said they could not make a payment, that's all. Next question. I'm gonna launch it right now. What type of insurance is from a person, their spouse, or legal guardian? Some of you may or may not have got this one. It does actually come from Karen's information that she presented last week. Okay, so Karen's information she presented last week. So again, it's all worked in, right? If you answered, sorry, I'm stuck. There you go. If you answered A, employer group health plan, you are correct. Liability, workers' comp, and no fault insurance are actually specific to a situation, not just general employer plans. So, okay. Next question. What type of insurance is primary to Medicare for all items and services the plan covers and Medicare covers? That should see that launch now. This one, for those of you that are not answering or unaware, it definitely should be. Oh, look at you guys getting it all right. It definitely should be your first one, employer group health plan. Why? Remember I said liability, workers' comp, and no fault? I just said it's what? It's related to a diagnosis. So therefore it's not everything. It's only those diagnoses. So hopefully that one does help you a little bit more. Let's move on to question number, sorry, cheated. Question number 4. Okay, as I launch it, what type of insurance is not primary to Medicare for all items, services covered? So look at this list and tell me which one of those is not primary. That is correct if you said B, the Federal Black Lung Program. That one is only primary when the Department of Labor gives a diagnosis that's on their primary list. So it's not all the time. It is really related to an item or condition. The reason I put that in is because there isn't a lot of black lung even in our area, but I wanted you to have the correct answer in case you saw it. Question number 5. What are the goals of the MSP program? Okay, what are the goals? No, it is not to annoy you. I know that was a great comment that was given. I love it. But yeah, what are the goals? This one, please select the appropriate answer if there's more than one. That was my hint. Hopefully y'all got that. So again, thanks for answering. And the correct answer is all of the above. That's really the goal, but all of the above. Number 6 is, okay, I gotta find it. Sorry, let me scroll down here. Here we go. Which of the following is a Medicare replacement, therefore not a primary insurance? Not considered primary because it's actually a replacement. So for this one, all of these have special circumstances. Medigap, supplemental. Medicare Advantage, that's your answer, because it replaces traditional fee-for-service or Part A and B, right? Veterans Administration, either they pay or Medicare pays, but it's not a replacement plan. Either they pay or Medicare pays. You can have both eligibility. It's not something like that. And then plans with policies stating supplemental to Medicare, those are supplemental to Medicare because that's what the patient bought them for. All right, next question. When must a provider ask if a patient has primary insurance? When must a provider ask if the patient has primary insurance? Oops, there we go. At the start of care, when care goes beyond 30 days, before billing for each service, this depends on if they are a facility or other type of provider. Technically, the best answer for this one is D, because yes, every provider must ask for the start of care. Then remember, a facility must ask at every inpatient admission, even if there's a 1 day lapse. A facility must also ask every 90 days for a reoccurring service. And outpatient people, which bills on the 1500 or the 837P, you have to ask at varying points of undefined time. Why is it varying points of undefined time? Well, because that's how CMS wrote it. But you do have to be able to gather um, whether it is still valid or not. And that's why it's D versus A. Yes, I understand you must ask at A, but there are also other situations. So we want to make sure we're getting that correctly. All right, moving along. This one is question number 8. We have 15 questions, just so you know, 15 questions. Does Medicare waive timely filing for MSP related claims? Yes or no? Do they do that? Kind of all over the board on this one so far. So the answer is no. So on the bottom, straight out, they don't do that. Now, why is that important? Anyone? The answer is because if you don't file it timely, even if you get a denial, we can't work with it. You're still going to get a timely filing denial. Timely filing denials are always your responsibility. So you'll have to write it off. Okay. Next, question number 9. Let me get that question pulled up for you here. CMS instructs providers to use a series of questions to determine primary coverage. Where are they located? I mentioned this as the footnote on another slide. There was a footnote on that slide. So the questions are located where? Oh, well, most of you got this one. CMS Medicare Secondary Payer Manual is the correct answer. The information that you need, you can check to see if there's primary listed in a variety of other sources, but the actual questions are in the Medicare Secondary Payer Manual. Next question. And I mentioned this again really briefly. So, which contractor maintains the primary payer files? This was part of that summary. And I said they need to update the file. Ooh, really split results on this one. Really, really split. This contractor is the Benefit Coordination and Recovery Center. They actually work with updating the files. The Medicare Administrative Contractor, or MAC, which is what WPS is, we process the claims. We may give them information to say this file needs to be updated to show something that was reported to us, but we don't actually update the files. And the CRC, the Commercial Repayment Center, they take money back from a commercial insurance, not the provider. The only one that works with the provider is the MAC. The BCRC can take money back from a liability or a no fault. So like when a lawyer contacts them and they have to go through that, that's all done through the BCRC. And the COB&R, that's just the full name of it, Coordination of Benefits and Recovery. That's what it stands for. So let's move on. Question number 11. Question number 11. Which tools provide free eligibility access to providers and their staff in the WPS jurisdiction? Now, I will tell you, I put this one in. I know we haven't covered it, but really I want to see how many of you guys can get it right without really knowing. And I will explain why it says free, because that is a key item there. So first, the information comes from the HIPAA eligibility transaction 270-271. That transaction is given to you for free from WPS in the Secure Net Access Portal, or SNAP. So A is our answer. HETS, that is a transaction which you can pay a vendor to access for you. So if you happen to have a free vendor, then great, HETS, but otherwise, no. Billing agencies and clearinghouses are typically paid, therefore that's not free. And direct data entry doesn't have eligibility information anymore. However, if a claim does deny for this piece of information, you definitely could look it up and find out about the denial, okay? This one is question number 12 is an interesting question as well, but I did just answer this a few minutes ago if you all were listening. Want to highlight the last word, providers. Providers. Let's highlight that last word. Which is the contractor that takes money back from providers? This contractor is the only contractor that providers work with. Hint, Medicare Administrative Contractor or your claims processor, that is WPS. That doesn't mean that we cannot be instructed to take money back from one of the other two. We definitely can. That definitely works. We, though, are the only one that you will actually get a letter from asking you for money back. This is a question designed in case you need to refer the patient to a website, because it's not our website. Medicare has a website specifically designed for that patient. So do you know which website that might be? First of all, I want to let you know that Medicare, or CMS, has a separate website from Medicare.gov. I'm sorry, from CMS.gov, and WPS has a separate website. These are both provider websites. So that's a hint. It's not ARC. The answer is actually B, Medicare.gov. This website will display information to the patient. It actually has a secure portal that they can log into as well. So it's really nice to give them that. One thing it does have is information or educational material written for the patient. So if you're looking for something, go to Medicare.gov and see if they have something out there. All right, question 14. 2 questions left. In which of the following, if which of the following does not pay, Medicare will consider paying primary, which excludes it from the MSP program. So which one of these is excluded from the Medicare secondary payer program? Because if they pay at 100%. There's nothing for Medicare to pay. As it tracks up, everybody's getting it right. So there's not much to talk about with this one. It is the Veterans Administration. Y'all got that one real easy. So, all right. Let's move on to the last and final question. I've asked something similar to this before, and I've emphasized this, but I'm going to ask it again. Are Medicare Advantage plans primary or secondary to fee for service Medicare? Most of you are getting it correct, so that's great. Great. All right. The actual answer for this one is neither. Remember, an Advantage plan replaces fee-for-service Medicare. So you bill the Medicare Advantage plan, you don't bill fee-for-service Medicare. So our answer is technically neither. All right, that brings us to the end of this section. Hopefully you all got some good information and the review helped you out. What I'd like to do now is start with some registration questions. We'll get through these and then we'll look at whatever questions you have in the chat. So here we go. Question number 1, what to do if the beneficiary refuses to contact Medicare to update their coordination of benefits? Providers have two options in this case. First, they can bill the primary insurance. They can bill the primary insurance, get a denial for that claim, and submit saying, hey, this insurance denied it. Second, they can contact the primary insurance and get a letter on the primary insurance's letterhead stating when the plan was effective and terminated, and then send that to the Benefit Coordination and Recovery Center, and they will update accordingly. So there's two options: bill the claim, get a denial, or get a letter from the primary, send that in and get that updated. Information on secondary payers, especially when the patient only has Part A benefits. So I wanted to remind everyone that Medicare Part A and B can require premiums. More commonly, Medicare Part B does have a distinct and separate premium. So if people choose not to pay that, they will not have Medicare Part B, which again covers professional services, a lot of supplier services. It covers some outpatient hospital, outpatient facility care. That's Medicare Part B. If they only have Medicare Part A, then it would cover inpatient care, doesn't matter facility type. It could also cover some of the hospice benefits, some of the home health benefits. So you still have to coordinate when they have that coverage. So you have to determine which benefit category, Part A or Part B, is covering that service. If they do not have Medicare Part B and they have primary, that's great. That's great. We don't really have a whole lot to say on that. Part A, on the other hand, you would then need to bill it, get the primary decision, and then bill us. So I was asked this one, and I do want to show this to you real quick. Hopefully a guide or a quick reference sheet. So let me just jump out to the website. I'm going to go to CMS website. The place I like the guide most is actually in training and education right here. And in the training and education on cms.gov, if you go to Medicare Learning Network here, then you go to resources and training, scroll down, come to resources and training on the left side again, go to publication and multimedia. I typically search for the word secondary. Okay, you can see it brings up a full booklet. Now, I'm not going to have you look through the whole booklet, but what I do want to let you know is that if you open the booklet and then you open the download section, if you go to page 4, you will see a quick reference chart. This moves through page 9 and is exactly hopefully what you're looking for. So please remember, CMS does state that we as a MEC cannot provide you the same information they have. We have to refer you to their publication. This is it. So if you just want to go directly to that booklet, and I think I forgot to put this in the information for Karen, so I'm going to go ahead and throw this in the chat for y'all. There's a link in the chat right now. It goes directly to the booklet. Next question. MSP claims billing best practices. So I'll do some best practices, but I'm going to tell you, if you want the full claim billing course, you will need to attend and watch for the future courses to be advertised. First, best practice, ask questions. Make sure that you have the primary payer information and in the correct order. Second, check your eligibility files. This is key. Let me show you where that is on our website in the portal, which is the SecureNet Access portal. So for on our website, you'll see this user login and password section. This is where you log into the portal. Now, I can't actually log into the portal because you can imagine there's a lot of PHI and PII in there. I have a need for it. But if you look at the portal user manual right here, and I select it, I can scroll down in the manual system. I can come to eligibility. Eligibility, you'll see it right here. Do an eligibility check under the header patients. And if you scroll through, it'll tell you how to do the eligibility check, what you should be looking for. Keep going down and down and down, and you'll see a variety of lists on the webpage. One of them that is grayed out on this one is MSP, or Medicare Secondary Payer. So if you scroll down, even though it's grayed out, and you can see it will actually provide you a variety of boxes. I'm just scrolling down to that tab so that you can see what information you would get within that tab should the patient have any. Now, somebody did ask, what does the gray out mean? And the gray out simply means there is no information available. There's nothing in that patient record. Okay, so here we go. But you can see you'll get the enrollment termination dates, insurer's name, group policy, all of these different types of information. One thing I want to remind you of, if any of this is missing in the Medicare enrollment record, the coordination of benefits record, we can't display it for you. Okay. So also, as a best practice, if you don't understand Medicare eligibility, call and ask. Another best practice, update your primary payer information before billing the claim. We're just going to deny it and you're going to have to update it. So make sure that you're viewing the information and getting it updated if it needs to be. We were asked about coordination of benefit recoups. For our purposes, they are the same as all other recoupments. You do have to check the proper box on the form or in the Medicare, in the portal, make sure everything is checked to let us know that it's what it relates to. You can pay the agreed amount of the recoupment, or you can disagree with it, which would be through the appeals process and ask us to recalculate it depending. You could also send in and say, hey, this shouldn't even be a recoupment because there's no primary payer. Look at your record now. And the record was then updated to reflect that. I'm not really sure what you were looking for more than that with MSP recoups. So before I leave here, let me just come back out here for a second. I'm going to go to tools, and out here is our website, tools, all tools. And then I'm going to go to all forms. So when we look at forms, if you scroll down, you will see a refund form. And if you select it, it'll tell you about refunds, how to get them, all of that. You can also see the overpayment form, and the overpayment notification and refund form is what we're looking for. Now, again, it's not under refund, it's under overpayment and refund. Then when we scroll through, and I'm just going to scroll to the bottom of this just before the form, it'll walk you section by section on how to complete the form. Make sure that you do the top 3 fields correctly. They are located in a line across the top. The contract, the Medicare type A or B refers to the CMS line of business. So UB 04 837I is part A, 1500 837P is part B, and then enter the state where the services were performed. These are used for sorting in our mailroom. So if they're not done right, yep, might take us a little bit to get it. Okay. Let's see. How do I contact MSP for verification, and how do I know if Medicare is secondary in determining the correct payer? First, you can get this online. You can get this in a self-service tool. Therefore, CMS does not allow us to give it to you. So you'll want to check our self-service tools. The portal is one way to do that. When I already showed you those screens. Second, if you do have a question regarding it, you can contact us, especially regarding the primary payer situation. And items like that, we can help you through that process. Next question goes back to those Medicare Advantage plans or Part C plans, and it says, do they have the Medicare secondary payer requirements? The answer is yes, they do. The Social Security Act dictates that all Medicare payers follow this, so they do have it. Great question. I already answered this one, but I'll answer it again. Is the Medicare secondary payer questionnaire or questions required for non-face-to-face encounters, such as telehealth, visits, and cardiac device interrogations? Oh, I'm sorry. Not sure what the spelling is on that one, but yes, it is. The reason that I say that is you still have patient contact, right? And so as long as you're having patient contact, the answer is yes. So what were the 2 exceptions? Remember, it was the lab whether it's an independent or a part of a facility. They don't have direct patient contact. How are they getting it? From whoever is getting the primary. Next question. What happens if the MSP questionnaire is filled out one way, but then we find out that it's not correct? And the answer is patients will tell you all kinds of things. If you know the information is not correct, you have to follow the correct information. So if the coordination of benefits system through the BCRC, which again, we did look at the tools, if that does not have the same or matching information, now you need to report it and get it fixed. Okay. Does the MSP have to match what you have? Great question. And yes, it does. The reason that we say that is if you put Blue Cross versus BC, it won't match. Our system may add that as a secondary one or a different insurance. And now we're looking for a couple of primaries. So if we say BC, put BC. If we say United Healthcare, put United Healthcare. If we say, a great example, BC of Ohio, then you need to put BC of Ohio versus Blue Cross of Ohio. Does that make sense? Hopefully it does. If not, add some more questions in the chat. I don't have a very good answer for the next one. I'll just warn you right out front. But why do claims keep getting denied for old MVAs? I'm going to assume you're talking about motor vehicle accidents. So it's either a liability or a no clout. The reason that they continue to get denied is that there can be set aside amounts and other things going on where this still will show as an active insurance. And because it's based in a diagnosis code, your claim may have that diagnosis code on it. So now you need to prove to Medicare that it's not related. Next question. How should provider handle appeals when MSP information changes after their initial claim decision? And what is the best practice for correcting the payer order retroactively? So first, if an appeal information changes and you need to file it, you do have to correct the order. That means you may need to build a primary insurance to simply get it in aisle and say, nope, not for this claim. Second, you can appeal that information for the claim. You cannot appeal the MSP information. You can't appeal that. On the other hand, you have to get it updated first. So if you have a record of when it was active and not active, you can submit that too, just like any other MSP primary payer. Next, why do we have issues with Medicare payment and putting it to co-insurance when they are secondary payers? So Medicare does calculate the deductible and co-insurance for every claim. Those are added to the remit notice. What the provider needs to do is to determine whether or not the patient owes them for either one of those. That's part of what Medicare has to give you. So you need to take the primary paid amount and the Medicare paid amount, add them together. Now look at the Medicare allowed amount and determine, did you get the same amount or more than the Medicare allowed amount? If you did, the patient doesn't owe you anything. If you did not, take the difference between that payment and the Medicare allowed amount, the two payments that you've received or three payments, add them together, get that difference, bill the patient the difference. Hopefully that helps everyone. How do you get to Medicare to reprocess claims if the patient updated their coordination of benefits to no longer have Medicare? And the answer is submit a new claim, submit a corrected claim if there's something wrong with it in the Part A processing system, so UB04 or 837I claim. Otherwise, simply submit a new claim. Does Medicare ever pay following commercial primary payment? And the answer is yes, but we do use a coordination system. So we can pay, however, the coordination system does allow for a little bit different there. I did explain this one just a couple seconds ago, but I do want to say it again. What unpaid dollar gets transferred to the patient? And it's anything owed up to the Medicare allowed amount after you've added the two payments together. Again, if you're paid more than the Medicare allowed amount, keep the money. The primary paid you more, great. Medicare and the primary paid you more, great, keep the money. All right, that's it. Yeah, for those questions, I want to pose to Karen, any questions?
Tom, we did get some questions in the chat. I also want to mention we did receive an email during the webinar that an attendee was having the chat wasn't letting her type questions in. So I just want to say if anybody else is experiencing that, please send us an email so that me and Tom can help you. I'm not exactly sure what's going on because we are getting some questions in the chat, but others are having issues. So I just wanted to bring that up real quick.
Okay.
The first question we got was, if we get a payment from primary and the patient responsibility is still $5,000, then we send to Medicare as secondary, and the Medicare EOB comes back with the patient responsibility of $250. Can we bill the patient the $250, or would we adjust off of this 4,750?
So the first thing you need to do, take the primary payment and the Medicare payment. Figure out the difference, okay, to what the Medicare allowed amount is. If you have a difference between the Medicare allowed amount and the money that you've already received, you cannot bill the patient. If there is still a difference, $250, something like that, then you can bill the patient. Please remember that there's a difference between the allowed amount, because that's what you're starting with. It's not just about the liability amounts. Those are set up differently and for different purposes. You have to calculate how much the allowed amount is, subtract the payments off, and see if there is a difference. Next question. Karen, you're on mute. I don't know if.
I'm sorry about that.
Okay.
A follow-up to that was, how would they know what the Medicare allowed amount is?
The remittance notice will still have the allowed amount on it. The Secure Net Access portal contains the claim information. You have to do a claim search and find the allowed amount. You could also download a remittance notice from there. So the Medicare allowed amount will be given to you, again, your remit notice, the Secure Net Access portal, any of those types of online tools.
Okay. Other question we get was, I missed what you said on recouping COB. Can you go over that again? I usually send, they have TF, so timely filing waiver, I'm guessing, or appeal in with the corrected claim to WPS. Does the RCBC update COB on WPS eligibility?
Uh-huh.
And if not,
So
can we access the BCRC?
the BCRC does update the coordination of benefits system. Once that comes through, which comes through the common working file, I guess a easy way to explain it is a communication hub. Let's put it that way. Common working file is the communication hub. So the coordination of benefits system and both claims processing systems talk to each other through that common working file. It's probably the easiest way to explain it. Once that comes through to us, if you have an overpayment, you can appeal the overpayment, not the claim, the overpayment, and say, hey, I don't owe you this. There's, look at your system. If you don't have that and you've done a variety of different things, you may write to us and say, hey, pay us back for, hey, I already sent you the money. I issued you the money. Now give us the money back. We can look into that. So it's really about communication. If there is a time when you need to rebill that, you can rebill it to turn it from primary to secondary. That is possible if you bill on a 1500 or a 37P. If you do a correction, which you can do, and then in the FIS system, which is a UB 04 or a 37I. So I'm not really sure what your situation is and how you bill, but they do have different answers. All right, Karen, anything else?
That was all we had, Tom.
Okay, we're gonna go ahead and move on. Hey, thanks for listening today. I do appreciate it. I would like you to take a survey. Now, the survey is going to be there when I close out. Karen's going to put a link for you in the chat. The survey is going to give you a little pop-up box when we close out. It looks like the external site here, spam, it's not mail or something like that. It's just our survey. What's great about it is we do have to consider all comments given. So did you like our new format with a question and answer? Have you attended the other ones that do evaluation and management similar to this? What did you think? Give us that information. If you're taking this online or you're listening to this as a YouTube presentation, we still want you to take this survey. We're actually going to give you a picture that looks like the bottom one, and it says online survey. It's just another way to take the survey. So we really do value that feedback. I will take questions for the next 7 days. And you do have to submit the questions to wps.gha.education@wpsic.com. And then in the subject line, put MSP intro webinar, MSP webinar, part 2 webinar, MSP part 2 webinar, something like that, just to make sure it comes to me and Karen so we can get it answered for you. Also, if you dialed in, but you did not provide us with an email, which is very possible, welcome, great. Just make sure that you send us if you need a certificate. Everybody else gets it automatically. You cannot get it automatically because you didn't provide us an email. Okay? Keep in mind, we will be posting questions back to you. I shouldn't say posting, that was a very odd word. We will be emailing questions back to you. So if you send us a question, we'll give you an email back. That's it, everybody. Thanks for listening. We appreciate your time, and I'm sorry I went a little bit over, but you may now disconnect.